What if the most powerful pain relievers on earth weren't locked inside a pharmacy, but growing in a garden, on a mountainside, or sitting on your kitchen shelf right now? For thousands of years, before synthetic drugs existed, humans relied entirely on plants to manage pain, fight infection, and calm their body's inflammatory responses. And here's what's remarkable: modern science is now confirming what traditional healers knew all along. Inflammation is at the root of some of the most common and debilitating conditions: arthritis, muscle pain, nerve pain, digestive disorders, and even chronic disease. And while pharmaceutical options absolutely have their place, research shows that several plants contain active compounds that genuinely, measurably reduce inflammation and pain in the human body. Today, we're going through 20 of those plants, what they are, what the science says, and how they've been used. Let's get into it. Plant number 1, turmeric, Curcumin longa. Let's start with the most well-researched one on this list. Turmeric is a bright yellow spice that has been central to Ayurvedic and traditional Chinese medicine for over 4,000 years. Its active compound is called curcumin, and this is where things get scientifically interesting. Curcumin works by blocking a molecule called NF-κB, which travels into the nuclei of cells and activates genes that trigger inflammation. Multiple clinical trials have found curcumin to be effective in reducing symptoms of osteoarthritis and rheumatoid arthritis, in some studies, performing comparably to ibuprofen for knee pain, but with fewer gastrointestinal side effects. One important note: curcumin on its own is poorly absorbed by the body. Combining it with black pepper, which contains piperine, increases absorption by up to 2,000%, according to research published in Planta Medica. How it's used: taken as a supplement, standardized to 95% curcuminoids, added to food, or consumed as golden milk. Plant number 2, ginger, Zingiber officinal. Ginger's pain-relieving ability comes primarily from compounds called gingerols and shogols, which inhibit the same inflammatory pathways as NSAIDs, the class of drugs that includes aspirin and ibuprofen. A 2015 meta-analysis published in Osteoarthritis and Cartilage reviewed multiple randomized controlled trials and concluded that ginger significantly reduced pain and disability in people with knee osteoarthritis. Ginger is also one of the best-studied natural remedies for muscle soreness. Research published in the Journal of Pain found that daily ginger supplementation reduced exercise-induced muscle pain by roughly 25% over 11 days. How it's used: fresh ginger in food or tea, standardized ginger supplements, or ginger essential oil for topical use. Plant number 3, willow bark, Salix alba. Here is one of the most historically significant plants on this list. Willow bark has been used for pain relief since ancient Egypt, Greece, and China. The reason it works is that its bark contains a compound called salicin. When salicin is metabolized in the human body, it converts to salicylic acid, which is the direct precursor to aspirin. In fact, aspirin, acetylsalicylic acid, was synthesized in the 19th century specifically as a modified version of this natural compound. Clinical research has shown willow bark extract to be effective for lower back pain, osteoarthritis, and headaches. A study published in the American Journal of Medicine found it to be superior to placebo in treating chronic lower back pain. Note: people who are allergic to aspirin should avoid willow bark. It should not be given to children, for the same reasons aspirin is not recommended for children. How it's used: as a standardized bark extract supplement or herbal tea. Plant number 4, Boswellia, Boswellia serrata. Also known as Indian frankincense, Boswellia has been used in Ayurvedic medicine for centuries and is one of the most promising anti-inflammatory plants in modern research. Its active compounds, called boswellic acids, particularly AKBA, acetyl 11-ketoboswellic acid, inhibit an enzyme called 5-lipoxygenase, 5-LOX, which plays a key role in producing inflammatory leukotrienes. Multiple clinical trials have shown Boswellia extract to significantly reduce pain and improve function in people with knee osteoarthritis. A 2003 study in Phytomedicine found that patients taking Boswellia reported decreased knee pain, increased knee flexion, and improved walking distance within 8 weeks. How it's used: standardized Boswellia extract supplements. Look for products standardized to AKBA content. Plant number 5, devil's claw, Harpagophytum procumbens. Native to southern Africa, devil's claw gets its name from the small hooks that cover its fruit. Its root has been used medicinally for centuries by indigenous communities in the Kalahari region. The primary active compound is harpagosite, an iridoid glycoside that has been shown in research to inhibit the production of inflammatory cytokines, chemical messengers the body uses to trigger and sustain inflammation. A systematic review published in Cochrane Database of Systematic Reviews found that devil's claw extract was more effective than placebo for short-term improvement of chronic nonspecific lower back pain. It has also been studied for hip and knee arthritis. How it's used: standardized capsules or tablets. Not recommended during pregnancy or for people with stomach ulcers, as it may stimulate gastric acid production. Plant number 6. Capsaicin, Capsicum annuum or frutescens. Capsaicin is the active compound in chili peppers, and it works through a completely different mechanism than most other plants on this list. Capsaicin binds to a receptor in your skin called TRPV1, the vanillard receptor. When applied topically, it initially causes a burning sensation, but with repeated use, it depletes a neurotransmitter called substance P, which is responsible for transmitting pain signals to the brain. Over time, this actually reduces pain perception in the treated area. The FDA has approved a high-concentration capsaicin patch, 8%, for treating neuropathic pain, including posthepatic neuralgia, shingles pain, and peripheral neuropathy. Lower concentration creams, 0.025% to 0.1%, are widely available over the counter and have good evidence for arthritis pain. How it's used: topical creams, gels, or prescription patches. Always wash hands thoroughly after use and avoid contact with eyes. Plant number 7. Arnica, Arnica montana. Arnica is a flowering plant native to the mountains of Europe and Siberia, and it's one of the most widely used topical remedies for bruising, muscle soreness, and joint pain. Its active compounds, sesquiterpene lactones, particularly helinoline, have been shown to have anti-inflammatory, analgesic, and antimicrobial properties. Research published in Rheumatology International found that Arnica gel was as effective as ibuprofen gel for hand osteoarthritis. Critical note: Arnica is for external use only. Ingesting whole Arnica plant material is toxic. Homeopathic oral preparations, highly diluted, are different, but the evidence for those is not the same as for topical application of actual Arnica extract. How it's used: topical gels, creams, or ointments, applied to unbroken skin for bruises, sprains, and sore muscles. Plant number 8. Lavender, Lavandula angustifolia. Lavender is primarily known for its calming, sleep-promoting effects, but it also has genuine evidence for pain relief, particularly through aromatherapy and topical application. Research has shown that inhaling lavender essential oil can activate the parasympathetic nervous system and reduce pain perception. A study published in the Journal of Alternative and Complementary Medicine found that lavender aromatherapy reduced pain in patients after knee replacement surgery. Other studies have explored its use for migraine headache. The compound linalool, abundant in lavender, has been shown in preclinical research to have antinociceptive, pain-blocking, and anti-inflammatory properties. How it's used: aromatherapy, inhaled, topical application diluted in a carrier oil, or in bath preparations for general muscle relaxation. Plant number 9. Cloves, Syzygium aromaticum. Cloves contain a compound called eugenol, which is one of the most well-documented natural analgesics. Eugenol has been used in dentistry for decades. It's a key ingredient in many dental cements and temporary fillings, precisely because of its pain-numbing and antiseptic properties. Eugenol works by blocking sodium ion channels involved in pain signal transmission. Research confirms its effectiveness as a local anesthetic and anti-inflammatory agent. Clove oil has good evidence for toothache relief, and in fact, many pharmaceutical toothache products use bentocaine alongside clove-derived compounds. How it's used: clove essential oil diluted and applied to gums for dental pain. It should not be used undiluted, as it can cause. Plant number 10. Peppermint, Mentha times piperita. The key compound in peppermint is menthol, which has two notable effects on pain. First, it activates cold-sensitive receptors in the skin, TRPM8 channels, creating a cooling sensation that can counter pain signals, similar in concept to how capsaicin works, but via a different receptor. Second, menthol has muscle-relaxant properties that can ease tension, headaches, and muscle spasms. A notable study published in Cephalalgia found that peppermint oil applied to the forehead and temples was as effective as acetaminophen, paracetamol, or Tylenol in reducing tension-type headache pain over 30 minutes. How it's used: peppermint essential oil diluted in a carrier oil, applied topically for headaches, muscle pain, or nerve pain. Peppermint tea may also help with IBS-associated cramping. Enteric-coated peppermint oil capsules have strong evidence for this. Plant number 11. Rosemary, Salvia rosmarinus. Rosemary contains several anti-inflammatory compounds, including rosmarinic acid and carnosic acid. These have been shown in research to inhibit inflammatory enzymes including COX-1, COX-2, and LOX, the same enzymes targeted by many pharmaceutical NSAIDs. Topical rosemary preparations have traditionally been used for muscle and joint pain. Some research has looked at its effects on knee pain. A small randomized trial found that topical rosemary oil compresses reduce pain intensity in knee arthritis. Rosemary also has a well-documented effect on circulation, which can help reduce pain caused by poor blood flow. How it's used: topically as diluted essential oil for joint or muscle pain, or as a culinary herb and tea for its systemic antioxidant and anti-inflammatory benefits. Plant number 12. Ashwagandha, Withania somnifera. Ashwagandha is an adaptogenic herb central to Ayurvedic medicine. While it's most widely known for its effects on stress and cortisol levels, its anti-inflammatory properties are increasingly well documented. Its active compounds, called withanolides, have been shown to inhibit inflammatory signaling pathways, including NF-κB, similar to curcumin. A clinical trial published in the Journal of Ayurveda and Integrative Medicine found that ashwagandha root extract significantly improved pain, stiffness, and disability scores in patients with knee joint pain compared to placebo. The connection to cortisol is also relevant. Chronic stress elevates cortisol, which can promote systemic inflammation over time. By helping regulate the stress response, ashwagandha may indirectly reduce inflammation. How it's used: standardized root extract supplements, often taken daily over weeks for cumulative benefit. Plant number 13. Holy basil or Tulsi, Ocimum tenuiflorum. Not to be confused with common culinary basil, holy basil, Tulsi, is sacred in Hinduism and a cornerstone of Ayurvedic medicine. It contains compounds including eugenol, also found in cloves, rosmarinic acid, and oxalic acid, which collectively inhibit COX-2, the same enzyme targeted by anti-inflammatory drugs like Selexib. Animal and early human research suggests Tulsi has genuine anti-inflammatory, analgesic, and anti-arthritic effects. A study published in the Journal of Ayurveda and Integrative Medicine found that Tulsi extract reduced blood markers of inflammation in human subjects. How it's used: fresh leaves, herbal tea, or standardized supplement capsules. Plant number 14. Evening primrose, Oenothera biennis. Evening primrose oil is rich in gamma-linolenic acid, GLA, an omega-6 fatty acid that, unlike most omega-6 fats, follows an anti-inflammatory pathway in the body. GLA is converted to DGLA, dihomogamma-linolenic acid, which competes with and limits the production of inflammatory prostaglandins. Clinical research has examined evening primrose oil for rheumatoid arthritis, with some trials showing improvements in morning stiffness and joint pain. A review published in Seminars on Arthritis and Rheumatism found that GLA supplementation from plant oils produced statistically significant improvements in joint tenderness and swelling in IA patients. How it's used: standardized oil capsules, typically 1,000 to 3,000 milligrams per day. Benefits may take 3 to 6 months of consistent use to become apparent. Plant number 15. Frankincense Boswellia, sacred variety. Boswellia sacra carterii. We covered Boswellia serrata earlier, but the sacred Boswellia varieties, used in traditional Arabic, African, and Ayurvedic medicine, deserve their own mention, particularly in the context of spiritual and chronic pain traditions. Research has expanded across multiple Boswellia species, all showing similar mechanisms through boswellic acid inhibition of 5-LOX. The resin gum has been studied for inflammatory bowel conditions and brain inflammation as well, with preliminary positive findings. A 2020 study in Fructose and Pharmacology reviewed evidence across Boswellia species and confirmed their significant anti-inflammatory potential, noting particular relevance for arthritis, asthma, and colitis. How it's used: standardized supplement or aromatherapy, resin burned as incense, though therapeutic effects in that form are less clinically established than oral supplementation. Plant number 16. Valerian, Valeriana officinalis. Valerian is primarily known as a sleep aid, but its mechanisms also make it relevant for muscle pain and cramps. The root contains compounds including valerianic acid and isovaleric acid, which interact with GABA receptors, the same inhibitory receptors targeted by some muscle relaxant and anti-anxiety medications. By increasing GABAergic activity, valerian can reduce muscle tension and spasm, which is one common source of chronic pain, particularly in conditions like tension headaches, back muscle spasm, and menstrual cramping. Research on valerian for pain is less extensive than for sleep, but its muscle-relaxing and anxiolytic properties are well established. How it's used: root extract capsules or valerian root tea, typically taken in the evening given its sedative effects. Plant number 17, California poppy, Skullcap californica. Important clarification up front: California poppy is not the opium poppy, Papaver somniferum, and does not contain morphine or opiates. It is legal, non-addictive, and entirely distinct. California poppy contains alkaloids, including californidine and ashwagandha, that interact with GABA receptors and opioid receptors to a mild degree, which may explain its traditional use as a gentle analgesic and sedative by indigenous peoples of the American Southwest. Modern research is still limited, but California poppy has a long history of use for nerve pain, headaches, and toothache in folk herbalism, and early pharmacological work suggests its compounds do have measurable analgesic properties. How it's used: tincture or capsule form. Considered safe at normal doses. Not for use during pregnancy. Plant number 18, cat's claw, Uncaria tomentosa. Cat's claw is a woody vine native to the Amazon rainforest, used for centuries by indigenous Amazonian communities for arthritis, inflammation, and immune conditions. Its active compounds, particularly oxandole alkaloids and pentacyclic oxandoles, have been shown to inhibit TNF-alpha, tumor necrosis factor alpha, a key inflammatory cytokine that is also the target of some powerful pharmaceutical biologics used in rheumatoid arthritis. Clinical research, though limited in scale, has shown promising results. A study published in Journal of Rheumatology found significant reduction in painful joints in patients with rheumatoid arthritis taking cat's claw extract. How it's used: bark extract capsules or tea. Not recommended during pregnancy or for those on immunosuppressant medications without medical supervision. Plant number 19, Skullcap, Scutellaria bacalensis lateriflora. There are two main medicinal skullcaps: Chinese skullcap, Scutellaria bacalensis, and American skullcap, Scutellaria lateriflora. Both contain powerful flavonoids, but Chinese skullcap has more extensive research. Chinese skullcap is rich in baicalin and baicalin, flavonoids that have been shown in multiple studies to inhibit COX-2, lipoxygenase, and NF-κB, hitting several inflammatory pathways at once. It has been researched for arthritis, neuropathic pain, and general inflammation. American skullcap is better studied for its nervine, nerve-calming properties, which makes it helpful for tension headaches and pain associated with anxiety or nerve sensitivity. How it's used: standardized extract capsules or tinctures. Most of the clinical research has been done on the Chinese species. American skullcap has stronger traditional use for nervous system support. Plant number 20, white willow bark versus meadowsweet, Filipendula ulmaria. We end with a pairing that tells one of the most fascinating stories in medicine. Meadowsweet is a flowering plant used for centuries in European herbal medicine for headaches, fevers, and stomach pain. It naturally contains salicylates, the same family of compounds as willow bark. In fact, when German chemist Felix Hoffmann synthesized aspirin in 1897 at Bayer, the chemical name, acetylsalicylic acid, was partly named after Spirea, an older genus name for meadowsweet. The word aspirin is partly derived from spur, from Spirea or meadowsweet, plus in a common chemical suffix. Meadowsweet also has a notable advantage. Unlike aspirin, it appears to have a stomach protective effect rather than irritating the gastric lining, due to the presence of mucilaginous compounds alongside its salicylates. How it's used: herbal tea from the dried flowers and leaves, or standardized extract, one of the most gentle natural sources of salicylate compounds. Before we wrap up, let's quickly connect the dots. These plants work through several documented mechanisms. COX inhibition, blocking the cyclooxygenase enzymes, COX-1 and COX-2, that produce prostaglandins, which trigger pain and inflammation. This is the same mechanism as ibuprofen and aspirin. NF-κB inhibition, blocking the genetic switch that activates inflammatory gene expression, turmeric, skullcap, cat's claw. 5-LOX inhibition, blocking a different inflammatory pathway that produces leukotrienes, especially relevant in joint inflammation, Boswellia. GABA receptor modulation, reducing nervous system excitability, which calms muscle tension and pain sensitivity. Valerian, California poppy. Substance P depletion, reducing the neurotransmitter that sends pain signals. Capsaicin. Cytokine modulation, reducing inflammatory chemical messengers like TNF-alpha and Illinois-6. Cat's claw. Ashwagandha. This information is educational. Here's what you genuinely need to know. 1. Plants are not automatically safe in all doses or for all people. Natural does not mean harmless. Willow bark, for example, has the same risks as aspirin for certain individuals. 2. Several of these plants can interact with medications, including blood thinners, diabetes drugs, and immunosuppressants. Always consult your doctor or pharmacist before adding herbal supplements, especially if you take prescription medication. 3. Quality of supplements varies enormously. Look for standardized extracts from reputable brands with third-party testing, USP, NSF, or similar certification. 4. Chronic pain can indicate serious underlying conditions. Plants can support your health, but they are not a substitute for a proper medical diagnosis and treatment plan. Nature has spent millions of years developing chemical compounds to fight infection, repel pathogens, and respond to stress. Humans evolved alongside these plants, and the evidence strongly suggests that many of them genuinely interact with our biology in ways that reduce pain and inflammation. The 20 plants on this list: turmeric, ginger, willow bark, Boswellia, devil's claw, capsaicin, arnica, lavender, cloves, peppermint, rosemary, ashwagandha, holy basil, evening primrose, frankincense, valerian, California poppy, cat's claw, skullcap, and meadowsweet, each have documented, plausible mechanisms and at least some level of clinical or historical evidence supporting their use. These aren't myths or marketing. They are part of a long, honest conversation between humans and the plant world, one that science is only now beginning to fully translate. If this video gave you something useful, share it with someone who deals with chronic pain. And let us know in the comments, which of these plants have you personally tried, and what was your experience?